I used to be an academic advisor, so I have long history of advising students. My name is Dr. Jeff Jones. I'm an associate professor in the Department of Health Policy and Community Health. I work in health policy and do a lot of stuff in data science and health informatics. My background is I have a bachelor's in psychology and a master's and a PhD in geography and regional planning. Um, so I've come to public health kind of through an unusual way. When I was in my doctoral program, I started working for a sociologist who worked in smoking cessation. Um, and then when my original College of Public Health, where I worked at the University of Kentucky, was formed, it was formed out of people who were anthropologists, geographers, sociologists, attorneys, but they were all people like myself who have worked in public health for a very long time. So I started working in public health in 1998, and I still remain there today. My research involves a lot of people come to me when they want a certain methodology, a lot of spatial analysis, like geographic information systems. I work also with statistical analysis, qualitative interviews, and focus groups. So right now I have a grant that I'm working on where I'm doing a statewide needs assessment of primary care physicians for the state of Georgia. I also am working on a grant where we are doing trainings for all of the hospital boards in the state. I also have a smaller grant that I'm working on with colleagues from nutrition and sociology, where we are going to interview seniors about their kind of sexuality, questions they may have about sexual health, STIs, things like that. I've also worked with colleagues in environmental health to do water quality checks on beaches here in Georgia. Um, Also have worked with rural hospitals to try to help them become more financially stable. So the core thing that goes with a lot of my work is using geographic and spatial analysis and data science, where we gather data and we collect it, we analyze it, and we put it into visualizations to help people digest it and use it. I come from a family of nurses, and so public health is kind of fits very well into what I was raised with my grandmothers and my aunts and my mom, my cousins, even today, one is a nurse, about trying to keep the public healthy. Um, to me, this is just another way of working to make your community better. There is always some new challenge in public health. It can be obesity, HIV, it can be health equity, helping people of diverse backgrounds have access to health care. It can be COVID. So there's always, it can be climate change. So I enjoy public health because there's always a new challenge. There's always something new in the world, something that you have to work with. And I also like that it does good. It is I feel good about my work, that it helps to keep people healthier, helps to educate people. These are all good things in my book. I used to be an academic advisor, so I have long history of advising students. And many of my students at my former job were pre-med. And I often would urge them to look at public health because public health teaches you about how to prevent disease in a whole population, whereas medicine teaches you how to treat an individual who is already sick. But public health gives you a lot of background into different chronic conditions like diabetes and food. It gives you a lot of background into epidemiology, into health data, how hospitals work. So I think that a public health undergraduate added to your pre-med courses is actually a great way to prepare you for medical school.